Welcome to the office.
Hi, Gloria.
How are you?
I'm good. Welcome to the office.
Thank you very much.
How can I help you?
My husband convinced me
Okay.
to come with you.
So, Mr. Miguel over here?
Yeah.
Yeah, so he was a patient. We have a
Because
video
he-
with him somewhere.
Yes, of course.
And
he showed all the family, all the friends, everybody.
But he obviously also got a result.
Yes.
He got a
yes,
result.
of course.
It's
of
not
course.
just that he likes me and my jokes
Yes.
and everything. He got the result, right?
Correct.
And I think that's why you're here. Let's talk about top 3 things. What are your top 3
Okay,
issues? So
3
we have
things.
somewhere to start.
Okay. I feel dura.
Tight. She feels very tight.
Se
Okay.
me inflama.
¿Dónde?
En general.
Dura.
O sea, no tan elástica.
Not that
not
elastic.
flexible.
No, flexible. Okay. Se
I'm
me-
learning a little more each day. So,
Se me inflaman las rodillas.
My knees are
My
ankles.
ankles.
Ankles are
ankles.
having
And in the morning, I feel my hands
stiff
okay,
and my neck.
and my neck. No? And for example, I said, Luis Miguel, when I put my arm in my back,
yeah.
esta se pone más alta.
That side is.
Y esta-
I am not able to move
Y
the
esta
left.
no llega. Ajá.
And her neck is stiff.
Okay, well, we got a lot of stuff going on here.
Okay.
There's a lot of stuff going on,
Hay
right?
varias cosas que están pasando.
Okay. Número uno. Number 1 problem.
El problema número 1.
Número 1. Back or up?
Arriba el cuello o la espalda.
Número 1.
Ajá.
What's number 1?
Back.
Back. Número 2.
Neck.
Neck. And número 3.
My knees.
Your knees.
Sí.
Okay. And, okay.
Because when I go to stairs, if I have zapatillas,
If I have low shoes.
Yep.
I need to.
It's hard.
Yes.
Okay.
To down.
Going up or going down?
Down.
Both knees?
No.
Right.
More right. Mm-hmm.
Okay. So this is also good information, guys, I want to share when someone's saying we're talking about knee issues, mechanical, and there's pain going up the stairs versus down the stairs. Going up the stairs is usually a femur issue. Now, there are always exceptions. It's usually a femur. Going down the stairs is usually a tibia issue. Okay?
Okay, great.
Usually.
If I have both,
Spine.
okay.
When there's a knee case and it wasn't this has been there for a minute, this isn't like an acute trauma that just happened, right?
Okay.
This didn't just happen yesterday, we have an acute trauma, we need
Si
to
no te
x-ray it.
pegaste,
No, no.
pasó.
So I wouldn't be touching the knee today for an adjustment anyway, we'll be working on spine first. We're gonna
Okay.
go over your x-rays, I'm gonna explain everything that I see. That's
Okay.
number 1. Number 2, you have questions along the
Okay.
way, I need you to understand, you know the process.
Okay.
Okay, we'll deal with it day by day, okay? And what you're gonna report back to me is what's different,
Okay.
okay?
Okay.
Sound good?
Yes.
Let's get started. So when we're looking at this, do we have a level base and foundation? No, we do not. We can see that the hips are different, and we can see that these holes are different sizes. And what's interesting in her case, I've never actually seen this. This is something new. I got a new finding.
Oh.
Simone.
What is that?
She's getting calcification of the pubic symphysis. The pubic bone, there's a cartilage in between, it's starting to calcify. That's the first time I've ever seen that, guys.
Okay.
Alright, no problem. It just means she's been stuck for a long time.
Dice que has estado atorada desde hace
Sí.
mucho tiempo.
So let's go ahead and look at the SI joints. We can see nicely through this SI joint, same thing, we have a little arthritic change here, a little calcification. We can see through the joint here, alright as well. You have a bent tailbone, bent sacrum, and the bent sacrum is contributing to the injury. Now, here's what's interesting, okay? So at the measured difference right now, why is it like that? Something is off there. It shows an AS10 EX2 on the left side, it shows a rotated sacrum on the left, but it's short on the right. So that she had a good trauma, whatever that slip or fall was, and it was significant enough. AS10 is pretty high. It's one of my high numbers. I don't think I've seen an AS10 in a long time.
Wow.
When I was in the Midwest back in the day, you know, it was prevalent with a lot of those tractor injuries.
She used to skate a lot.
Skate.
Roller skate?
Roller skate.
Roller skate, but
Many times she followed.
era muy inquieto.
In your case, so the left side has gone AS. And AS means this. Let's talk about it. So the way the pelvis works, it works in opposite. Her left pelvis has gone AS, up and slightly out. The sacrum on that left side came back a little. That's the disconnect. But this AS10 is kind of significant where it's throwing off the pubic bone a little bit. Mira, so the left side goes AS. It goes up in the back, so it brings this left side slightly down.
Down. Okay.
Now, in your case, I don't know what's happened there in terms of whatever happened here, but it looks like it's actually calcifying this ligament. So, I know there are some people that do pubic adjustments. I don't do pubic adjustments as such. We'll do it through the adjustment of the pelvis to affect that, okay? So we have a rotated pelvis, we have a rotated sacrum, we have a drop sacrum.
Okay.
Okay? So we need to decide, are we starting on the pelvis or the sacrum? What the book says to do in this case is to start on the sacrum. Now, if we do the pelvis first, we make the hip worse.
Okay.
Simple.
Yes.
So, sacrum. Now, that slight short leg on the left is creating this curve. She needs to get her thyroid checked. The thyroid is off a little bit. The good news is that the Megan Blvd, I mean, it's the good shape, but the size is like a third of what it should be. She has a lot of calcification, arthritis. And has she had a bone density exam?
6 years ago.
6 years ago.
It was okay?
Estuvo bien.
You need to
Yes.
you need to recheck it.
Okay.
Okay? And I'm going to tell you, Miguel, what this case is to me, okay?
Yes, sir.
There's a lot of, this is a digestion case and possibly a thyroid case.
Okay.
Okay? It's a foundation, obviously. We deal with her foundation.
Okay.
This is a digestion case. We don't fix and talk about her digestion on these visits here. She's producing a lot of inflammation in her body, and she's not absorbing and assimilating. And my concern and worry for a lot of patients, especially 40 female, with digestion problems, not absorbing and assimilating their nutrients, leads to a lot of low bone density.
Okay.
And Dr. Gonstead found this a lot, right? When there was stomach problems or digestion issues in females getting absorption issues, they had a lot of bone issues, a lot of density issues, which then leads to more serious things without me saying it, okay?
Exactly.
So I see this as primary digestion,
Okay.
okay, with the foundation. Everything else is bonus.
Okay.
I can adjust things and she feels good and we crack it and blah, 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 but the digestion doesn't get fixed, she's always going to have pain.
Okay.
Okay? No joke. And then we have a left jaw, right compensation as well.
Okay, es una compensación de las...
Número 1, 2, 3, 4, 5, 6. This is your digestion area right here. Her 5 is off, her 6 is off. And I don't know what this is. There's some sort of calcification going on in her chest. And I don't know what that is.
Okay.
So that's something that does need to be addressed at some point. Let's look at the side profile. And let's give her some good news first, okay?
Buenas noticias.
So the good news is this, your discs are still good. You can see there is a bent in the tailbone that we talked about. We're going to start there. The disc is a little bit less and tilted, but it's still decent. 5, 4, 3, 2, 1, 12. 11 is where it levels out. The next one that goes out, 10, 9, 8, 7. Next one that goes out is 6 or 7. Okay, then we're going to look at the flexion extension of the neck. Her neck curve is decent. She's held up. I believe it's due to her activity levels is what helps keep her together. Okay? We want to make her mo better. This is neutral. extension. Looks like she extends. And when we go forward, you can see all these move. That one didn't move right there. 2, 3, 4, 5, 6. 5 or 6? Ah, number 2. Hold on. I found something else. Ah, don't you love when we just find these little things? They're so
Little
cool.
hiding.
Yeah. Ay, caramba! I got you.
Ya encontró lo
Número 2. T2. T2. T6. Sacrum. C6.
Translate, please.
C6.
C6.
Este problema. Número 6. Número 2. Número 6.
Cuando
You can
dijo,
keep on.
cuando dijo de la cadera,
When she said about the hip,
yes, when I drive
when she's driving,
or sleep,
Why I
yes,
yes,
and I put my hand here and
she has to put
push.
something.
You feel like this, right?
Yeah. No, I think that I need to put my hand on
That's
On the
something
right
is
side or
missing.
the left side?
right side.
Oh, okay. Let's fix that for you today, okay?
Yes.
That's inflammation.
I have for a long time.
See, and he didn't fix you, take you to get fixed, huh? Walk to the corner of the room and back. She got a Mexico City tinkle.
Okay.
She don't got the wiggle or the jiggle.
No, she's
It's
a-
a little tinkle.
Que es una pequeña.
It goes little tick, 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 tick.
Tick. She's always saying that I'm very healthy.
So
I'm
she
very
walks like this.
Yeah, exactly.
Seriously,
Mhm.
she walks like that. Come on, let's
You
fix you.
understand? Órale.
Siéntate aquí, por favor. Starting at the base of the neck. Número 6. Número 2.
Le hiding surprise.
Número 6, 7. It's nice when it matches, you know. There it is. Sacrum, 15 points. Left side. Okay, señora. Para al frente. Al frente. Feet together. Open and close the knees. Open and close. Mariposa. Right side only. Derecho. When she does the right, the left is moving. Izquierda. But
Izquierda.
when she does the left, the right moves though too. Scoot back for me, please. So we're
Hacia
starting
para
para atrás. Mira, número 5. ¿Duele? Número 1. Número 2. Número 3. Aquí.
Ay.
She's a tough cookie right there. Número 4 or número 3. 3. Head down, please. Round your back.
Curva tu espalda.
Curva tu espalda. Static palpation.
I told her this is not the moment to be tough.
What do you, yeah, no. 1, 2, 3, 4, 5, 6, 7. 7 or 6. Mucho duele 7 or 6.
I don't feel.
No duele? Bueno, let's leave that then for right now. We're going to focus on S3.
Pero es que aguanto mucho.
Uh-huh.
But she says that it doesn't hurt so much, but her pain tolerance is.
But you feel that it's a little different compared to the one above and below, yes?
Okay.
Okay.
Okay,
So when I say, okay, let me rewind, and this is
Okay.
actually a very good point I need to make.
Okay.
So the Gonstead work is a comparative analysis. You're comparing the vertebrae above to the one below. When you're doing the pelvic analysis, you're comparing left to right side. So when we're even doing the analysis of the vertebrae, and I said, duele? Or if I'm saying, does that hurt? And I should
Okay.
correct myself.
Okay.
Does that feel the same as the bottom and the
Okay.
top? to correct, okay? Very important, that way they understand.
Okay.
So if I go here, duele?
No.
Okay, but is that the same as this?
No.
Does this one hurt more, a little
Yeah.
more than this?
Yes.
You see?
That's different.
So we
Yes.
have to be mindful in our communication now,
Okay.
guys.
Got it.
This one or this one? This one
This one.
or this one?
I think that is same.
This one. Starts here.
Same.
Not this one.
No.
Bueno. Head down, please. Uno, dos, or tres.
Uno.
Uno,
Yes.
dos,
Ay.
tres. That's okay. That's okay. Let me do the work, please.
Here.
7,
Uh-huh.
6,
Yes.
7, 1. One's not moving. But neither is 2. 3. 2, 6, sit forward. Alright, let's check the shoulders. Right shoulder.
Trono.
She said it was hard to bring the left or the right behind?
¿Cuál te cuesta trabajo mover para atrás?
The right.
This one.
The left one.
Look.
But the right is more crunchy.
Pero el
Ajá.
derecho truena más.
Yes.
So
Always.
that means you're compensating the right because the left is not
Of-
working as much.
Yes.
Okay. Now, mira. Da-da, da-da, da-da. Let me do the work. We're just checking the
Sueltes.
movement. Okay, you feel it's not smooth, right? It's okay, but right when we get back here. Okay? Now watch this. This is okay. Compared to this side.
Okay.
Oh, this is an interesting case.
Ah.
There it is. Okay.
Yeah.
Ahí está.
So we will test this after the adjustment, okay, madam? So here's my game plan for her.
Okay.
And the way we're gonna do this
Eso es el plan.
is we're gonna do foundation for sure, right? S3. After the foundation, we're gonna do T2. After T2, I'm gonna have her, actually no, let me take that back. Let me take that back. And the reason I've changed my mind is this. 2 is rotated, 3 is rotated, 4 is rotated, 5 is rotated. It's starting at 6. So we're gonna do 6.
When I move my head,
Mm-hmm.
I feel that es más limitada.
It's limited.
Hacia la
The left
izquierda.
side is limited more than the
More
right
than
side.
the right
Okay,
side.
so here's how we test that. Turn left. Look up, turn right. So the looking up is the lower cervical spine. Look down, turn left. It's not upper. Upper's fine.
Para
Okay.
arriba está bien, para abajo lo limitado.
Okay, let's get started. You ready for me, madam?
No. Yes.
Let's do it. Face down, boca abajo.
Silence.
Oh, she's tight. Híjole. Perfecto. Thank you. Híjole. Número 6. Alright, I guess I'll do it a little textbook. 3, 4, 5. PR-T. That's part 1. Now we're going to do spinous contact to get a little more P to A. That was the rotation. Ay, caramba. Poquito más. There you go. Gotcha. Step away, sir. Let's get a little more of that low back. It was good, but there's more. We happy and we know it. We happy and we show it. Relax. Up, 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 up. Okay?
Arriba.
Okay? The Cairo family. Da-na-na-na. Shh. Bueno. She's smiling a little bit, but...
¿Qué estás?
Señora!
Va a dormir en el baño.
Ya.
Then I'm going to sleep on the bottom.
Let's come up. Caminas, por favor. Uh-huh. Turn around, please. Okay, walk. Keep going. Uno más. ¿Qué diferente? Anything different?
Pain.
Pain.
In my back.
Have a seat there. Let's see. C6 is clear. T2 is clear. Oh, good call. T6 cleared the neck, sir. So even though, madam, even though we have those and we'll probably need to deal with it, it started from here.
Oh, not the neck.
Tell her to move her neck, should be
Que
different.
mueve tu cuello para que para ver cómo lo sientes. ¿Lo sientes
Better.
diferente? Much better or
¿Poquito mejor?
Yes.
o mucho?
Poquito mejor. 0, 0, 0. Clarísimo.
Que está muy
Mira. So even though she said she didn't have pain, she should feel it feels
But
smooth.
I feel different.
You feel different now,
yes,
right?
but
Good.
like little pain.
Okay, but easier to move.
Uh-huh.
Se mueve más
Now, let's check the shoulders and see if it changed. Mira.
fácil. Los hombres a ver si
Ajá.
cambian, a ver si cambian.
Ay. Oh, yeah, yeah, yeah. No.
I feel.
Right there, yes?
Yeah. Oh, yeah.
Okay, relax there for a minute. Let's do the right.
The bottom polish.
Chiquitas.
Bring your left hand behind your back,
Tu
please.
mano izquierda atrás de tu espalda.
Up.
Arriba.
Okay, and back around.
Regresar.
Do it again,
Hazlo otra vez.
and back forward.
Y de regreso.
One more time. Back forward. Again. Back forward. Now the right side.
Ahora la derecha.
It's when we get to her T2, we're not there yet.
Okay. It all depends if she doesn't hit me too much today.
Just let it, you're gonna have a little soreness, it's just a part of it, okay?
Oh, I
Things
don't
are-
understand.
Vas a tener un poquito de adolorida y como estaba yo antes.
Okay, madam, this is where we're gonna start, okay?
Okay.
And squeeze my
Thank you
hand.
very much.
Squeeze, squeeze. So you have a lot of confidence in your husband to come here, I think.
Yeah.
Confianza en mí por haber venido.
Turn and face that way. Hi.
Oh,
Señora, I see you mañana.
see you tomorrow.
Okay?
And thank you
Nice
very
to
much.
meet you, mucho gusto. You what?
Menos acartonada.
She doesn't feel stiff. She's feeling more loose,
Okay, good.
and she feels her back different.
So, it's been a few months, sir.
Yes, sir.
How you been?
Very good. Very good.
You showed me a video. I was kind of impressed. You're a quarterback.
I have been doing better
Uh-huh.
since all the visits and everything, and thanks to you.
It's been several months, though, dude.
Yes, and every time I'm able to move better, to do more stuff, to
Awesome.
recover my life.
Now, question. Did you have any setbacks or did anything new come out?
Well, actually, one of the things is that I have a problem with one of my feet.
Yeah.
I was playing volleyball at
Yeah.
the sand, and so, I don't know if I took when I make a step, one of my fingers moved different, and it's getting a lot. I have a lot of pain.
Which one?
The left side.
Which toe? Which number?
Number 2.
The big toe is number
big
1?
toe is number 1, number 2. It's between number 2 and number 3.
Okay.
And that made me hump. And when I start humping, I feel a pain in this area.
Got it.
In all
And you were playing soccer? Football?
No, football. Oh, exactly.
Número 5.
Number 5.
Número 1.
No.
Número 2.
No.
Número 3.
No.
Número 5.
Yes, number 5.
She gets to watch you on the knee chest table today.
Yo no te toca. I was not expecting.
Head down, sir. Let's see.
When you do that, I feel the
Right there.
right there. Yeah.
So we're gonna do C7 and L5.
Okay. I know what that means.
We're gonna start on C7 here first, okay?
Okay, sir.
Sit back for me. C7. Come on. Left ear down, down. No. You're gonna make me work, sir.
Oops.
Let's go over here, face down, please. Ah, let's bring. He's got a little bit of extension there, so let's do this. There you go. Número 5. Tummy down. All the way down, sir. Down. Knees back a little bit. Poquito más. Bueno. Down. Good. Down. Oh! That's the home run. Ah!
Ay, ay, ay.
Poquito. Come on up.
Oh.
Step away from the vehicle, hold my hand. That was nice, deep this side.
Oh.
Let's walk. That woke you up.
It was spicy, yeah.
That was spicy, I know. Keep walking, my friend. Walk about 2 times, please. Neck is clear. Claro, clarísimo. Cero.
Oh, very good.
Very good. On your back, please. Let's do your feet. Turn it up.
You want me to show my this is where I feel it's swollen, this part.
Okay.
So when I touch over here, the pain is here and here. It's exactly, it's, oh.
Leave the socks off then, go on your back.
Okay.
All right.
That was spicy. I still feel it.
Yeah, but you'll see the swelling come down a lot from that. This, right?
No, more. Oh, yeah. Oh, that it's.
So that's
Exactly.
the metatarsal head dropped. Let's follow it. You need to go get foot x-rays, dude.
Okay.
Something's off.
Yeah, and that's exactly what I feel.
I'm not messing with those toes. There's a lot of stuff going on in here. What I'm going to do first is I'm going to set the ankles. Remember,
Okay,
85% of all foot problems start from a misaligned talus.
Okay.
We're going to set both talus. You're going to go get your
X-ray.
feet x-rays. She needs her knee x-rays.
Okay.
But please, I want that before I start going deep into those toes.
Perfect.
Okay?
Yes.
No guessing.
Yeah.
Sit and turn, sir. Yeah, I don't want to guess.
Yes, I think something is off. It's
Something is off, but what I need to see are 2 things. Something is calcified in your foot. That's what we need
Okay.
to see. There you go.
oh.
Nice. Nice.
Oh.
Squeeze. Very nice. There you go. Squeeze.
No.
Squeeze. Squeeze. That's where we're gonna start for today. Okay?
Perfect, sir.
Welcome.
Thank you very much.
Welcome back to the
Welcome
office.
back to the office.
And
Yes.
for you, bienvenidos.
Bienvenidos.
A la oficina.
I'm your oficina.